Chairside shade guide is unique. This is not acrylic. This is not denture teeth. This is a porcelain teeth. So basically I made press with a GC pressable ingot, and then we press it 50%. And then after that we layer with GC porcelain, all different layering color. So top of that we add to it, and then I created the size of teeth from incisor and gingival about 10.5 millimeter and width about 8 millimeter, and the thickness of teeth about 2 millimeter, which is very reasonable thickness, trying to match natural teeth concept. So that's why this is really unique shade tab. Then technician and dentist can use the patient teeth trying to match custom shade color, and then technician, include me, once they choose it, so I use with the GC initial porcelain trying to match exactly duplicate this color. Which is, we have a formula which is very simple to use it. So please contact the GC America searching for initial porcelain system.
This 3.0 age categorization concentrates on a higher opacity and brightly colored appearance, which translates into a higher concentration of enamel in makeup. The enamel color is bright white and medium white, covered together in natural dentition's chemistry. There is also a higher composition of dentin with enamel overlay in the 3.0 young or cosmetic selection. Opal, translucency, variations of white calcification, different colors of mamelon, and bright enamel with higher dentin are the selections offered in this grouping. .0 enamel presents with many variations in color. Orange, gray, brown, and yellow are some of the more common possibilities. In order to mimic natural dentition, we have mixed the colors to create the complexity, tone, and depth of color we see with natural tooth color. Detailed attention has been paid to the internal dentin color, the incisal edge, the gingival 1/3 staining, and the translucency or transparency, as dictated by age. High enamel color is imitated in the 3.0 series, with less enamel and greater translucency in the 4.0 series. The shade tab variations are based on natural dentition, as seen in patients' mouths. Because of in-depth research, we are able to offer a true repetition of lifelike enamel colors. The 5.0 Seasons of Life shade tabs concentrate on the color of our teeth when we are in our later years. In our youth, we have a deep layer of enamel which is opacious. As we age, this layer wears away and becomes more translucent, as seen in the 4.0 series. When we enter our later years of life, the enamel is almost always very light or completely gone, leaving a clear outer layer over the dentin. There are several possible combinations of color that have been used in this series, and in varying degrees of intensity. The categories of intensity are subtle, moderate, and heavy, with brown, orange, gray, and yellow as the color choices. When we reach this age group, our dentin color is intense in appearance, with transparency layered over the top. Until now, a shade tab that takes all this into consideration has not been available to any clinician or technician, and yet we see it all the time in the mouth. So, in order to correctly match a person of later years dentition, we must take these modifications and possible staining into consideration. The shade tab variations are based on natural dentition, as seen in a patient's mouth. As a direct result of in-depth research, we are able to offer a true repetition of lifelike enamel colors. 6.0. This series concentrates on the posterior and canine teeth, occlusion 2/3, with 4 different popular color groupings to divide the sequencing: white, gray, tan, and opal. The differently toned shades of white include solid white, chalky clear white, subtle white, gray white, and light yellow white. For the gray series, we have included translucency with white calcification, gray-white calcification, gray and opal blue, and solid gray. Each of these series depends on the thickness of the enamel and how much of the dentin color shows through the tooth structure. For instance, if the enamel is chalky in color, we will see less of the dentin color underneath. In the tan color distribution, the possibilities are light tan, medium tan, and dark tan, due to staining and the level of enamel that is left on the teeth. These are the most common shades of tan that we find with the occlusion 2/3 of the posterior teeth. Opal will present itself as clear, clear gray, light opal, or dark opal, which mimics amalgam often found in the posterior teeth. (7.0) After preparation, the stump color of the tooth is commonly anywhere from very light to black. Taken into consideration is the gingival area, the appearance of a post-core, and dark stump color due to internal and external staining. Each shade tab has pink porcelain added to the gum area to mimic pink tissue. It is especially important for cosmetic cases that we take into consideration whether or not the stump color is brown, ochre, black, or gray, and how much graduation of color we need to cover. Our surface texture possibilities include 4 commonly seen surfaces: natural, misty, vertical, and vertical horizontal. There are 6 possible tissue colors from which to choose, all in varying degrees of pink. Some are darker in tone than others, but all are created by blending the porcelain and applying an enamel overlay color based on what is seen in the mouth.